Good morning, and welcome to today's webinar organized by Konect. And this morning, we'll be talking about understanding cholera, the epidemiology, transmission, and One Health approach to prevent and manage cholera. And with us is our speaker, Dr. Bolanle Akanbi-Akeem, who is a One Health communication expert. So shortly, I would introduce and read the citation of our speaker for today. Akanbi-Akeem Bolanle is a Nigerian veterinarian with a profound expertise in One Health communication and promotion. She currently works as a project assistant at Livestock Management Services. In her role, she supports the project manager in coordination and the technical activities to strategically ensure sustainable animal health. She also serves as a field veterinarian in the combating antimicrobial resistance in Africa through a data science project. A project LMS partners with the International Foundation Against Infectious Diseases in Nigeria. She is a master's in public health. She's a master's in public health student and student representative at the Department of Community Medicine, now University of Nigeria, Abuja, Nigeria. She's a member of the Toastmasters International Club, Topaz Toastmasters Club, and serves as the Vice President, Public Relations Officers. In this role, she helps the club to engage with social media networks and bring in new members. She previously served as Community Engagement Officer at Farm Alert. In this role, she worked with the Community Engagement Manager to educate veterinarians, farmers, and veterinary students through telemedicine. She has previously served as Communication Assistant at One Health in Action Initiative. In this role, she works with the Executive Director to educate the general public on One Health related issues through active social media campaigns. She has also interned at One Health lessons to build a social media networking skills. She did her NYSC as a research technical assistant of an ECOWAS PACBAO 11 projects in Agolong Consortium. One of her achievements as a youth corper was winning the Access Bank grant, which she has used to continue her One Health advocate, even post-service. While in school, she joined several humanitarian campaigns, which has been beneficial to her and people in her community. She was a junior ambassador of One Health, OIE, since her graduation from undergraduate school. She has volunteered for Mark A's Veterinary Clinic, Immunity Veterinary Clinic, and then as a part-time staff as a veterinary doctor in FCT Abuja, Nigeria. As a young veterinarian, she is passionate about One Health. One Health has been one of our most top priorities. She's currently a volunteer at One Health in Action Initiative, which is devoted in One Health advocacy. She's an excellent communicator and always dedicated to interacting with people through sharing knowledge. She always sees herself as a team member, go-getter, and someone who is always ready to learn. She's passionate about assisting others to achieve their goals with her skills. Ladies and gentlemen, I would love you to welcome Dr. I would love you to welcome Dr. Akanbi-Akeem Bolanle. You have the floor, ma'am.
Thank you so much, our able moderator, for giving me that warm welcome. And I'm really excited to be invited to come and share my knowledge on such matter, as cholera has been one of the trending issues of global health importance, especially here in Nigeria and also in Africa, most African countries. So I won't bore you today. I'm sure every one of us listening to this has heard about what cholera is. Cholera is not new to us, and One Health is not new to us. Some of these terminologies are not new to us, but what are the basic things we need to know about these things that can make us a little bit different in preventing such diseases? So without wasting too much of our time, I would like to be sure that the people here with me are actually here with me. So if you have ever come in terms with cholera, please type in yes in the chat box. Thank you. I need 3 yes in the chat box for me to share my slide. At least 3 yes in the chat box. I have 1, I have 2, I have 3. Thank you so much, Fortune. Thank you, Jacob. Thank you, Otitochukwu. And thank you to the moderator. So I will thank you, Dr. Sherifat. So I will be sharing my screen. If you can see my screen, please moderator, please help me make a comment. Is my screen clear enough? Okay, thank you very much. So as I said already, today I'll be discussing understanding epidemiology, transmission, and One Health approach to prevention and management. So, what is cholera? What is it all about? Cholera is simply a waterborne bacterial disease commonly caused by the bacteria Vibrio cholera. It is characterized by diarrhea and dehydration. If you have experienced any of these symptoms that I just mentioned, maybe diarrhea or dehydration, just comment diarrhea in the chat box. Let me know if you're following. If you have experienced me, I think I've had some issues like that once or twice before. If you have experienced any of these things that I think it could be leading to symptoms of cholera, kindly make a comment in the chat box. Some of the symptoms of cholera include rapid onset of watery diarrhea, there's vomiting, there's muscle cramps, and if this kind of disease is not treated at the right time, it can lead to death, because once you are dehydrated, you're already weak. How can this cholera be transmitted? It can be through ingestion of contaminated water or food. So this diagram is just, I'm sure you can see it, it's just a pictorial diagram of somebody consuming the bacteria that is already contaminated what this man is consuming. And this indirectly goes to the gastrointestinal, and they start playing games, and this person starts showing symptoms of dehydration, starts vomiting, starts going to the toilet more often. So why are we discussing this disease today? Cholera remains a very significant public health threat in many parts of the world, especially in areas where there's inadequate water and their sanitation is very poor. So I would like to start with the general epidemiology of cholera. So this map here is showing Africa, is showing America, is showing Eastern Mediterranean, is showing the European part, there's the Southeast Asia and the Western Pacific. So Cholera has been a pandemic since the 19th century, and the World Health Organization had estimated that cholera is between 1.3 to 4 million cases has been reported over the year, with more than 21,000 deaths to up to 143,000 deaths. I've already mentioned the geographical distribution where it's present in Asia, Africa, and some parts of America. So, in order to respond to this public health emergence, there are intentional international efforts from WHO and also the Global Task Force on Cholera Control to help mitigate this global issue. So I would like to briefly discuss the epidemiology of cholera in Africa, and I'll briefly tell you the recent times of cholera. So cholera accounts for more than half of the global incidents in Africa. There are frequent outbreaks in Nigeria, there's DR Congo, there's Yemen. For example, using Nigeria as one of the sub-Saharan parts of Africa, it's been endemic in Nigeria for decades, and it has been present since the 1970s. From my research, it has since 2021, we have had over 90,000 cases and over 3,000 deaths of cholera. So let me bring us back to the one that has happened recently. About 2 months ago, that's June 2024, the Lagos state government recently declared a cholera outbreak. If you have heard it in the news, just kindly put it in the chat box that like you've heard it in the news, just to be sure that I'm not the only one listening to this news. 3 days later, they reported more and more in different states, and we have people who have died. People have also survived because they've also been treated. So high risk areas of cholera in Africa, we have coastal regions, we have the refugee camps, we have urban slums with poor sanitation. You must have heard, I keep on talking about poor sanitation. So this bacteria dwells in poor hygiene places. It dwells in areas where there are poor sanitation. What are some of the contributing factors to cholera? Poverty, lack of access to clean water, inadequate healthcare infrastructure, and conflict situations. The public health impact of cholera is that it strains the public health systems. When many people are being rushed into the hospital for such a case, the people delivering the health facilities, they become overwhelmed, and they can't give the right amount of treatment that they're supposed to give for these cases, and it leads to high mortality. So this is just me showing an example of what I've said before. If you look at this water, majority of these people are still, they are going to wash with this water, they are going to bath with this water, and you still find them swimming in this water and also fetching some of this water back to their houses to drink, to eat, and they come down with this disease and they become sick. They don't even have enough healthcare facility to give them better condition. So transmission of cholera, I've mentioned it before, there's the primary mode, which is the ingestion of water, contaminated water, and contamination often in areas with poor sanitation. Another one is carriers. We have some carriers of cholera. These are people that they don't show the symptoms, but they can easily spread the bacteria. Then we have environmental reservoirs. This is cholera-causing bacteria, which can survive in brackish water, coastal water, and they are in association with planktons. Then we have the seasonal patterns. If you notice, this one that happened June 2024, it coincided with our rainy season because we have more water, so it can lead to contamination of the water. So what is the impact of cholera on public health? So I broke it down into the mortality and morbidity. There is cholera which can cause death due to severe dehydration and is highly fatal. Then there's the economic impact because more money is needed to more money will be needed to treat, more money will be needed to help with productivity. Then it causes healthcare system strains. It overwhelms the healthcare facility, especially in areas where there's resource limited settings, where they cannot have access to much healthcare facility. And it can also cause long-term consequences. It can affect the person's psychology and also affect the affected community. Sometimes communities that come down with, they have more reported cases of cholera. People tend to stigmatize them because they are already seen as the carriers of such a disease. So moving on, the major thing that can help us with approaching, helping us with this cholera to help cope, to help mitigate, is utilizing the One Health approach. And how does the One Health approach help? It helps through coordination, through proper communication, and through collaboration. And all this is not just one sector. It's not just saying it is just for the human health person to work on it. It's not for just the animal health or just the environmental health. It is everybody coming together to work and advise the public, coming to the grassroots level, coming to the community level, the national level, and the global level to help curb this. So we need to also integrate the water and sanitation hygiene program, monitoring the water environmental quality, controlling the spread of the outbreak. Also, we need to improve disease surveillance and enhance response capacity such that when there's an outbreak of cholera, there's an emergency preparedness group that is already dedicated to tackling this infectious disease. So what are the prevention strategies? The prevention strategies I will still maintain is the water, sanitation, and hygiene. There should be access to clean water. The little quota you can do is that if you cannot provide clean water for them, you can keep advocating so that the right NGO can hear, the right government agency can hear that access to clean water in these communities that are prone to cholera, you keep advocating that, let them hear, let them listen, so that they can help to provide safe drinking water and reduce this cholera from spreading. Another thing is sanitation facilities, construction of latrines, proper waste disposals, sewage management to prevent further contamination. And you can also advise these communities that hygienic practices can help them. What are these hygienic practices? Promoting hand washing, safe food handling, and also proper storage of food and water. Then lastly, community engagement. Community engagement cannot be overemphasized because preventing this disease is not a one-man thing. It's a together thing. It's something that everybody needs to come hand in hand, because once this thing spreads, it spreads like wildfire. So this is just a slide to show that there has been vaccination that has been done to prevent this disease. Although I couldn't get success stories for Nigeria that they've been able to have a successful vaccine coverage, but I saw a vaccine coverage done in Burkina Faso, which has helped them to prevent cholera to some extent, and has been proven to be successful. So some of the vaccines available is the Coral, Shankol, and Uvicol Plus. So you can also preach that people endeavor to use more vaccines to curb it, especially in children between 0 to 5. So some of the challenges and the future directions, I mentioned them before. Some of the challenges could be resource limitation. So some of these things cannot be curbed because there's insufficient funding, there's inadequate infrastructure. Then climate change too is not helping matters. There's increase in extreme weather events, and it's leading to frequent outbreaks that it can just come anytime, it can come anyhow. Then antimicrobial resistance, emerging resistance to antibiotics using cholera treatment. I think antimicrobial resistance is one of our new anthem, because many people keep preaching about antimicrobial resistance. Somebody would just have, some of us are guilty about it, that we are we are just purging and we just want to use metronidazole, are we even sure that metronidazole is the right thing we should be using? So we should be careful in the kind of antimicrobials we use when we show some of the symptoms. We need to be able to use the right drugs to tackle this infection. So some of the future direction would be strengthening WASH, continued investment in water and sanitation infrastructure, innovative solutions like using technology in disease surveillance and outbreak response. Then sustained effort, this is where the One Health approach still comes into play, long-term commitment to cholera control at national. I would not want to start with national, at grassroots level, community level, then at national level and international levels. If you have stayed with me up till now, thank you for listening. And I have a short call to action. Please, I will encourage us to keep advocating for better WASH practices, support vaccination campaign, and participate in One Health initiatives. Thank you so much for listening. And I think I can hand over to the moderator. Thank you so much for listening.
Thank you very much for this wonderful session. So we appreciate it. I think it's now time for those that have questions and I can answer them. So anybody with any questions, let me check the comment section.
So if I've not cited any questions, if there are no questions, if you have any opinion, if you had witnessed any cases of, I can see my...
Yeah, someone is asking if we can get the presentation slide.
Definitely, I've shared it with Dr. Jacob, so I think you can share it with the group.
Okay.
I can see Dr. Sherifat here. She's also very vast in One Health. I'm sure she has one or two things to tell us, something she has heard about cholera, or if she has ever witnessed a case. So if you don't mind, she's one of my professional mentors, and I'm sure she has something to say. Thank you.
All right, ma. Dr. Sherifat, ma, please, you have the floor, ma.
Good morning, everyone. Good morning, and thank you for the request. If the moderators are okay, then I think I can share one or two things. Sometimes when we look at diseases that are associated mostly with humans, and then we as vets, I'm saying this based on my opinion that majority of the individuals in this presentation are veterinarians or at least para-vets or something like that. We tend to associate diseases mostly found within humans, and we just say, yes, it's within human. Let the human medic take full, let them take full, okay, let them handle the situations, you understand, and just leave it within their domains. But one thing that we forget to acknowledge is that as veterinarians, para-vets, people who handle animals, we are human beings, first of all, before we are veterinarians. So whatever has to do with humans, we should also participate. And how can we do that? That is within the domains of One Health. And these are things that are open to us. There are researches, and we have the strategic plan for Nigeria and other things. So how can you participate as someone within the animal health? There are some parts that we may fail to acknowledge. That is the way and manner of waste disposal within our animal health care system. Within some abattoirs, especially during the rainy season, because of the strategic positioning of the abattoir close to water, running water, there is a practice which shouldn't be of this of abattoir waste directly being just disposed into running water. And what this does, not only affecting biodiversity within the water, within the plants, the animals in the water, we have the ammonia level, the sulfur level, just taking out the part of the environment. This flows into community where people drink the water, where they do not have proper knowledge of means of sanitizing this water. So this comes back to us, and it shows that it is indeed our domain, especially within the One Health strategic approach. So we are to, within our professions and whatever we are doing, to advocate proper disposal of waste coming from the animal sector, because these adversely come back to haunt us in forms of cholera outbreaks and many disease outbreaks. So these are the little things I'd like to add, and thank you very much.
All right. Thank you very much, Ma, for that insightful contribution. I guess people have questions to ask you. Please, so if you have any question, please ask either for Dr. Sherifat or for Dr. Lawal, for Dr. Akeem.
So if you do not have questions, I have seen people who have joined this session from beginning till the end. I'm looking at some names. I'm seeing Judah Shaba. Is there anything that you learned in this presentation, or do you have contributions or questions you'd like to ask me? I see Fortune, I see Jide, I see Okidibatolu.
Okay, good morning. Can you all hear me?
Yes, good morning.
All right, my name is Fortune. I'm a veterinary student in the University of Nigeria, Nsukka. I am currently in my final year, 600 level. So I wanted to ask, because due to the public health importance of this disease that we discussed now, and owing to the insights shared by the Dr. Balogun, yes, few minutes from now, this is I shared about abattoir. It got me to remember when I had a series of abattoir visits in my local community over here at Nsukka, and how the waste was being disposed. So in trying to remedy this, or kind of like prevent it further or going forward, what would you suggest, as it is already existing and that practice is already ongoing? We as veterinary students, how do we think we can be able to come in curtailing that particular practice of waste disposal?
Okay, before I allow Dr. Sherifat, because I think she works in abattoir, so she's very vast in that. For me, I would just say we can keep advocating. You know, some of this, I noticed that we concentrate more on advocacies like AMR, we concentrate on rabies. Maybe maybe we should take some of these our campaigns and advocacy, maybe particularly on wash campaign, we take it to the abattoir. Like we reach out to the likes of people, veterinarians who are already working in the abattoir, that okay, let's come and carry out such a campaign in the abattoir, to talk to abattoir workers on water and sanitation hygiene. That's just me thinking as a junior colleague, but I'm sure Dr. Sherifa might have something maybe more professional to say, if she's still on the call. Dr. Sherifat.
Thank you, Dr. Bolanle. Let me just share one or two things in terms of my experience. The abattoir system currently is facing severe decay, and this decay is because of the infrastructure. There's so little funding to the abattoir system. So we have abattoir structures constructed within the 70s. These were plants that were designed in different countries, and it was effective at the time in the 70s and all 60s, and that is some of the things that we are using in today's world in the 21st, let's say 22nd century. So the way the abattoir was constructed at the time cannot be compared to the amount of animals that is being slaughtered now. So what I'm trying to say is that the capacity that these abattoirs were built for, like I would say where I work at the Cairo abattoir of the FCT, the capacity is like 20 at a time, but we end up slaughtering over 150 sometimes, and this is just cattle. This is over 150 animals every day, almost 500 sheep and goats. So because of the way our diets and access to need for protein in our diet has changed, and then we have more and more people into rearing of animal, which has caused serious drain on the capacity. So this also reflects in the hygienic level of our abattoirs as well as the waste disposal. So rather than them doing what is actually obtainable in the Western world, that is to treat the waste before they come out. So these wastes, there's the solid and there's the liquid. The solid, the liquid, we have the blood, and I'm talking about byproducts now. So some of the byproducts, bones, that's the solid. They are very good and important for us to use for animal meal production, calcium fortification, and others. So in the processing of this byproducts is a big problem because of lack of funding, and then the bias of thinking, or let's say the lack of care in the world of thinking of understanding how this is a public health problem and is causing death. And the way we don't collect data, we just tend to just blank our mind that these things are happening, but they are happening. So what I would suggest, not to talk too much about this issue, is to ensure that the byproducts as well as the animals are taken into full consideration of how they can affect our health. The byproducts should be treated, and there are various ways, sustainable ways that this can be done. Water should be treated coming out of the abattoir such that these waters are even reusable, because in some abattoirs, you see there's lack of water. You see some people harvesting rainwater to use on our meat, contaminating the meat in the process. So we should use sustainable methods, biogas, and people will talk about landfill that is not good, but other sustainable methods should be used. And let's not forget that the human being, the abodes of people are now moving so close to abattoirs. So they are just in the face of this waste in terms of waste disposals. You have some people who are living close to the abattoir just dumping their domestic house waste into waters as well as feces and things like that. If there is more advocacy and there's more policy ask, then we will see partnership, One Health partnership in waste disposal, which is exactly what we should advocate for, wherever we are. And that is all. I hope I've not spoken too much. Over to you.
Okay, I think he has a network issue, so we can keep it interactive. Who else wants to speak on what they've heard about cholera or something, or any advocacy that has been done on cholera so far in your own settlements? And keep it a little bit interactive. I can see, yes, I can see Dr. Jacob. If you're with us, you can unmute yourself. If there's something you've learned on this presentation, just before the moderator is able to get back with us.
All right. Thank you very much, Dr. Bolanle. Can you hear me?
Yes, we can.
Oh, okay, amazing. All right. So it's been a very wonderful session. Getting to learn from the figures, the current estimated infection with cholera, and then getting to know that currently there are vaccines for the cholera. It's interesting knowing that. I think currently there is no much done around here in Benue State where I am residing. And I think this is a call to action, especially on the area of WASH initiative that encourage personal hygiene and sanitation. So I think this is more like a trigger. This is more like a call to action, and I look forward to taking that challenge at the areas I'm working on as a student and more. Thank you very much, Dr. Bolanle. It's been a wonderful session.
Thank you so much. And I don't know if the moderator is back or if there's anybody else that can take the baton to help us to facilitate this session.
Yes. All right. Thank you very much once again, Dr. Bolanle. I think the moderator has probably a network glitch. So thank you very much for honoring our invitation to speak with us this morning. We are so honored, and we've learned a whole lot. I personally have learned a lot from cholera. It may look like a common thing, but anytime we have the opportunity of listening to experts like this, there is always something new to learn. So thank you so much. I believe every one of us on the call has learned something. So to everyone on the call, thank you so much for joining. Thanks to the contribution of the various speakers, the various participants around. Notably to mention is Dr. Sherifat. Thank you so much, ma'am, for joining. We look forward to keeping in touch. Thank you, everyone. Thank you, Ayolwa. I'm sorry, I guess I've not called the name correctly. Thank you, Praise. Thank you, Jide. Thank you, Tolu. Thank you, Fortunes. Thank you, Vivian, our host. Thank you, everyone, for joining. It's been a wonderful session. So at Vet Connect, we are committed to improving animal health care in Africa. And while doing this, we are committed to improving human health as well. We go with a One Health approach. And this is why we are not just focusing on animal health alone. And if you are a vet and you're on the call, you can sign up on our platform, the Vet Connect app, where you can register. And after registration, clients can actually easily access you, and you can explore the Vet Connect app for more information about Vet Connect and what we are doing at Vet Connect. And we currently have monthly webinars that are committed to improving animal health care um, in Africa. And we have sessions that are targeted towards students, improving students. And so if you are a student and you're on the call, we encourage you to participate in our champions webinar and the general webinar, which is this one. We do it on a monthly basis, and we believe it's going to be a wonderful learning experience for all of us. So once again, thank you so much, everyone. In absence of any other thing, we shall call it a day. Thank you so much.
Thank you.